الدكتور سعد الرشيدي، وهو استشاري علاج الأورام بالإشعاع، تخصص دقيق براكي ثيرابي، الأول في السعودية والثالث في العالم كله ما شاء الله. وهو أيضا رئيس جمعية الشرق الأوسط للعلاج الإشعاعي والأورام. دكتور سعد، وجودك معنا إضافة كبيرة للملتقى، وإحنا جميعنا نتشرف بك. تفضل، المايك عندك.
السلام عليكم وشكرا لك دكتورة إيلاف وشكرا للشباب ما قصروا الدكاترة كلهم الله يعطيهم العافية. I'm so happy to join for this young gentlemen and ladies who are joining inshallah the specialty soon radiation oncology عشان بس الوقت. Uh, it is a really evolving specialty. As Dr. Ilaf mentioned, it's not new. It's been there for almost 100 years. Everyone been using the radiation, but as evolving and modernized specialty really came almost 10 years ago when everything evolved in oncology. This is about me already, Dr. Ilaf mentioned. So it's 5 year specialty as any Saudi board almost. The disclosure, I didn't do my residency here. I did it in Canada. It's 5 years. We built the program almost the Saudi board 5 years ago. We will have the first graduate, inshallah, this year. It's a newly born specialty. We started almost in 2019 for the beginning of 20 for the radiation oncology. Now, if you think about it, it is oncology and therapeutic radiation. Most of the oncology specialty, like medical oncology and palliative care, already been, especially in Saudi Arabia, for so long. Radiation oncology being practiced in Saudi Arabia almost for so long, but it's mixed with the oncologists, that they call them clinical oncologists and radiation oncologists. Now, clinical oncologist is the one who's been certified from Europe. Anyone trained in Europe, especially the, I would say, the senior graduate or senior consultant, they are clinical oncologists, and the maybe the medium to young generation are radiation oncologists, which is in North America, US, and Canada. They offer purely radiation, and you don't give any medication as medical oncology. Now, the Saudi board is the North American template, I would say, analogy. So it's only radiation. If you are specialized in radiation oncology, you only do the radiation medicine, not the oncology or medical oncology. How many years, like everyone from the resident that they outlined, you do exams. And we put the program almost, I was involved from the very beginning as a resident in Canada and Saudi board. And I led the program at King Fahd Medical City almost 2 years ago. It's evolving. Now, the exams, maybe like every 2 years you do exams, but we are changing it in more comprehensive and CBD style. It used to be like the first year there is exam, and then the second year there's another basic exam, and as every like residency in Saudi Arabia, and also you sit for the final exam. But it is evolving now as the same of the North American training, that you do a comprehensive CBD program, or the comprehensive practical evaluation from the program director, and then you sit for your basic exam, and then you are finalizing your certification at the Saudi Commission. How many, sorry, it's like a little bit behind. Okay. So there are some electives for, there is mandatory rotations and elective rotations. So radiation oncology, if you think about it, it's not internal medicine or not medical specialty and not a surgical specialty. It is in between. It is more of radiological specialty, plus you are involved with the patient, I would say, face-to-face. Those who haven't seen the specialty yet. So you are dealing really with more of the diagnostic plus the therapeutic of radiation, and you're sitting in between the as medical doctor and also as a surgical doctor in between. So you rotate as a basic rotations through these general rotation, Now, this is the same again of the North American training. You go through internal medicine and also the surgical specialty rotation, as well as some basic rotation that most of you are familiar with. And then in your second year, you go through more of the specialty, more focusing in the, categorize that into sites. So you do sub-site malignancy rotation, like thoracic, abdominal, and other rotation like palliative, and all focusing in more on the radiation. And then once you graduate more and you evolve more through your training, you go more radiation oncology, and then you focus mainly in the radiation oncology, and you have one elective in your third year, and then you have more in the fourth year when you are graduating as senior resident, and then you do more elective rotations. So I mentioned that it's not medicine, not surgery. I tell you about my background. I started as a neurosurgery resident. I finished almost 4 years in Canada and then switched completely because it was not really taught well here in our medical school, neither in our hospitals before. It really collect all the aspect of medicine from basic science, the diagnostic and the technology, as well as the radiobiology and imaging. So it has a lot of things to do. It is one of the, so social life is good, but you need like really to dedicate yourself through the training, really very intense training, especially through the, between the clinics, emergency, as well as the studying these different technology, as well as the different medical background. Our social life, not too bad, apart from dedicating yourself through the residency. Maybe after the residency, as every residency program, you'll have a better lifestyle, even you're in surgical specialty. But one of the disadvantages, it needs intense training. The technology language, as well as the science, is really not taught in the College of Medicine. So most of us really introduce into the physics principle, as well as into the some idea that we never even taught through the medical school. So it's not like the medicine or the surgery that you go through your medical school and then you build on. So you definitely go through studying the machines, the anatomy of really the linear accelerator, as well as the physics principle that most of us really in medical school, they do not like. Again, we are not purely technologists like the physicists, and to correct this language, but you need to go through really intense training in physics, in radiobiology, and basic science to catch up really the language of this specialty and to do the clinical radiation oncology, I would say. Although after you graduate from your residency, as most of us, you probably do not worry about, most of you studied through your residency. And the practical part need, you spend more days, especially what they call it, the contouring or drawing the tumor, as well as the organoids or the structures that you need to prepare the plan for the patient and to send every package to the machine. I mentioned about the physics and radiobiology, and one of also the downside of these specialties, although it doesn't really reflect a lot nowadays as before, it needs very highly specialized center, and probably the one who's thinking too much about the job, although now, again, it's not very important. You need to know that practice in very highly specialized cancer center. Now there is movement that, even to put like standalone clinics, and in that way also you can practice as, the dermatology or the ophthalmology or other specialty that, you can practice in only a small clinic rather than a complex or a complicated hospitals. So this is one of the things, the same of the style of the North American, like in US, it's a standalone clinic that you treat the patient and then the patient can go home. Now, one part of the procedural radiation, like brachytherapy, which I'm specialized, that you need the patient to be probably in the hospital for 1 day. It's a day surgery, and you need anesthesia, and you need more time to spend as interventional radiation, call it, for the gynae and the prostate, which is still under taught. So I mentioned, I am going really through the template, sorry, and I don't want to go out of the book. Very good lifestyle as required from here to answer your questions. The lifestyle of the residency not too bad. We are so lucky to have the evolving technology, especially the computer as well as the remote communication. So we do our work not necessarily really standing in the hospital every day or every hour. So we can communicate with each other as well as with the patient, even sometime remotely. So we have more now with the evolving technology in the world as remote work that with these expensive machines. So available residency program. So we started again a few years ago, just like 5 years, and the graduate, as I mentioned, this year. So it started as a joint program. The initial joint program was Riyadh-based, and then the West. And when I took over in the residency almost 2 years ago, we separated King Fahd Medical City. Now the standing alone or separate independent program from King Fahd Medical City, King Faisal Hospital, as well as the King Fahd in Dammam. And there is a joint program in the West provinces. And really the peripheral cities, as you may know, they don't have even access to the machine or the center yet. So would you join? Yes. For me, I converted even my specialty, and not, I'm in love for that, but, it is a good specialty. If I reflect back, even of my decision changing from surgical specialty, and I'm not driving too much to the radiation oncology. So yes, I would not regret going to that specialty. Again, what's new in the specialty? The technology is evolving. The machine is so expensive. You're talking about millions of real or dollars to buy the machines, as well as the infrastructure for developing the center, and treating the patient as well is not cheap. Sorry, I just want to commit for the time because I were a little bit behind, but if you have any question, you can access my social media. I'm very visible in the Twitter and also all the social media aspect, and you can also fire me email any time. شكرا لكم ووفقكم الله.